Thank you for having me today.
Wait, you're not live. You're live now. Okay.
Oh.
Right. Tell everyone your name, please.
Sure. Hi, everyone. My name is Cassandra Palmer. I go by Cassie for short. I am here today, I guess, to tell my story, our family story, which began shortly after my son's MMR vaccine in early 2000s. He had the seizure, the full thing, seizure, high fever, and regressed and became nonverbal, staring off into nothingness. And it was around this time Dr. Andy Wakefield came out, and he was a godsend. It was from his statement, his testimony, and sharing all the work he'd done on the gut biome. So I seeked out a physician in the metro Atlanta area that helped me with my son, and I quit my job and helped get him back on track. Now, what brings me to you all today was I actually signed this up on accident, but I felt like it was meant to be by the universe, so I'm going to just keep going. So when I did decide to start going back to work, I ended up in the unlikeliest of places in a work comp sales support role, and I would assign catastrophic nurse case managers to work comp injuries, and also do something called medical bill reviews and medical cost projections. There's a lot of fancy terms for a lot of money in the industry and where you can save money. I got to learn how the ins and outs of the claims community, because I ended up doing group health as well. But what I ended up discovering was, in America, the standard of care is set, honestly, by Center for Medicare Services, and there's a full racket around that as it goes to insurance companies and how they claim, what they set their prices at versus what Medicare says is a fair and appropriate price. This is all based off of a cost to charge, so every procedure that's ever done has to be submitted to CMS, and doctors, whatever it costs, has to be submitted to CMS every year, Center for Medicare Services. They determine what a profit margin is, and from there set whatever the allowable is for your knee replacement, your whatever. Okay, so that's one cost, and then they take into account regions. That said, in the group health space, there is a racket, basically, and I don't know how to say it another way, and I had to leave because I couldn't keep representing what we were doing. I ended up getting into something called reference-based pricing, which goes into ERISA law and causes a whole nother issue. But essentially, we're fighting the hospitals and overpriced billing. And I didn't mean to go into this, but I figure the general public needs to know this, that there is an egregious price difference and you need to fight. It's the same as if you buy a lawnmower or something, in a way. Let me say it a different way. The hospital industry is the only industry where you walk in the door and you're signing on the dotted line that you're going to agree to pay for everything and everything they're going to do to you without even knowing what that price is. It's the only industry that happens, and it's not right. And so there's got to be, there is some stuff and legal stuff that's going on with that. But long and short, I left this world, this corporate world, and during all this, from my son's brain injury in early 2000, that we also had a house of mold that we were living in, same time. We got out of that. My husband at the time got out unscathed. I had a ton of health issues, wasn't sleeping, digestive, all sorts of stuff. But yeah, he ended up with a brain tumor called an oligodendroglioma, and ended up with a secondary brain injury from over-radiation of the tumor site. That caused me, if it wasn't for working in the work comp community and having my nurse case manager friends, I wouldn't have known he needed a neuropsych exam, because what I was seeing was worse than when he had a tumor. The behavior, he was acting like Jim Morrison. I mean, I was pretty sure I was going to find him dead in a bathtub, drinking, and I don't know. It was crazy, and it still is crazy, as a matter of fact. So, gosh, that was 2009. He is 49, 50 now. It started in like 39, I think, is when it showed up. So, yeah. But anyhow, so that started me down the road of brain injury. because I needed supports. I mean, it was kind of crazy around my house. And plus, I had Gabe I was dealing with, and then my own health issues. And we have other children. Anyhow, long and short, somehow as I was leaving the corporate world, I wasn't leaving yet. This is the beginning of COVID. And I kept going down more and more rabbit holes, so to speak. We all know that here in the truther community. But we were facing that vaccine mandate at my work, and I worked from home doing sales support, and I was already fighting them, and I was like, no, listen, this is not a law. And I went through all that, so I was ready to leave, and a friend had kept asking me to take over as the executive director for Brain Injury Association of Georgia, and I was like, oh God, no, that sounds awful. But anyhow, I ended up taking the job, and as I've been here, we've done some great work. But what I'm really here to say today is talk about today is more on the brain injuries. And so I'm here today personally, but also in the fact that we represent brain injury in Georgia. I have seen an uptick. It's typically been historically traumatic brain injuries caused by a concussion, a car accident, a fall, something trauma to the head. Those are typically the higher amount of calls that we see in the state. That changed this year. Those calls are now, it's flipped. So 2/3 of our calls now are acquired brain injuries from stroke, heart attack, vaccine injury, undisclosed, long COVID, and other things. But then also we have TBIs are still continuing because there's also a huge accidental force out there going on. So I guess what am I here to say today is we are seeing the effects of the vaccine and the jabs, and I have lived my entire life trying to do the right thing and do what people have told me to do, our doctors, our government, only to find it's hurt me. I've got injuries too. I was given tetracycline as a child, ruined my teeth. Apparently, if you do an autopsy on me, apparently my bones have gray rings if you had tetracycline. And I don't know, but you can't sue them and you can't do anything about it. And it's, my husband ended up with a TB, basically we couldn't even call it a TBI, but I don't know how it can't be a TBI when you've been over lasered at the tumor site. And then I can tell you from my time in the claims community, doing a medical cost analysis or a Medicare set-aside report, that means you have to look at someone's injury and get an idea of what it's going to cost for the lifetime of that claim. And the biggest cost, what do you think it is? It's pharmaceuticals by a gazillion. I mean, the dollar amounts in each of these traumatic cases or any kind of catastrophic case. Now, this could be burns. It doesn't have to be brain injury. I'm talking about work comp injuries. It could be anything, right? I've seen some horrific cases. But yeah, the industry, it's corrupt, it's wrong, and it needs to stop. And I know I have data and real life experience to bring to the table. So I just probably fired myself on camera, being that I'm with Brain Injury Association of Georgia. I have no idea how this is going to turn out. And I am also here today to contact Memorial Hospital and find out what's going on with their rehab for brain injury. So I am working in pleasure. So.
Thank you. Quick question. Did you take the COVID shot?
No.
Did you get COVID?
Yes, in 2019 before it was announced, and at the time I was doing benefit open enrollment meetings, and I think I got it in St. Louis.
and so you're alive, which is great.
Yeah.
So because we're led to believe that you will die if you don't take the COVID shot. How did you treat it?
So it's funny, I didn't know what it was. I just know it was going on forever, and it was 2 weeks in. And so I come from a farmer family in Pennsylvania and stonemasons, and we love the land, and I went back to our old school remedy, and what got me over it was wormwood. I do wormwood extract. I treat our family for parasites monthly during the full moon cycle or quarterly, depending on where we've been and what we've been doing. And that is what ended it. And that was after I went to gosh, I missed the entire holidays in December. Like, I got it literally the 23rd of December. Sometime in January is when, and that was when I was like, this has got to be a parasite or something. So that's how I got over it. And then I had a secondary bout with it when I had a nephew living with me that was vaccinated. And I was like, oh my God, this is COVID. So once again, wormwood and
All right.
HCQ.
Well,
Yeah.
thank you, and thank you